a GI and GU assessment. So I have started my head to toe on GI. So that's gastrointestinal. I'm going to make sure that when I'm exposing the patient that I'm covering up other areas. So I'm just going to expose the abdomen right now. I'm going to first look at the abdomen. I'm going to look at what it looks like. So is it distended? I'm going to ask the patient, are they having any pain? Because I'm not going to touch anything that's painful. I'm going to leave that till last, because if I start touching it and the patient says, oh, that's so painful, he might not let me continue my assessment. So I've looked at it. I'm looking for any bruising, any moles, anything like this patient has some ostomies. I'd be looking at that. So I'm going to listen. And when I listen to 4 quadrants. I usually start on the right lower quadrant and then go around, because that is how the colon goes up. So the colon starts at the right side and goes up and then around. So I'm going to put my stethoscope in my ears, always making sure that my stethoscope is clean before I do this. I'm going to listen. And I'm going to be listening for a gurgling sound. So I'm going to start the right lower, go to the right upper, go to the left upper, and then the left lower. I'm going to be looking for hyper and hypoactive sounds or absent sounds. If you think your patient has absent vowel sounds, you have to listen for at least 5 minutes to determine that in each quadrant. Okay, so now I'm going to palpate. I'm just going to lightly touch to see what the firmness is of the patient, and if there's any distension or any pain. Obviously, I need to ask the patient questions like, when was the last bowel movement? Are you eating okay? I'm going to be looking at to see if he has any dentures or he needs anything to help with chewing. I'm also going to ask if he's having any nausea or vomiting. Okay, I'm going to go lower to GU. I see that this patient has a catheter, so I'm going to always make sure that there's no kinks, everything is nice and clear. I'm going to be looking at the bag. This bag should always be below the hips, because you don't want any of this urine going back into the patient. This could cause infection. So this is always below, never touching the ground, because all of this inside is sterile. You don't want any bacteria going in there and going into the patient, causing something like a UTI. I'm again looking at the bag, looking at the color. Is there anything in there? Is it yellow? Is it dark? If it's dark, it could mean the patient might be a little bit dehydrated. Is there any red? Is there blood? Or anything like that. So any abnormalities. It goes all the way to the patient. I'm making sure the patient has a stat lock. This is the stat lock. It just clips this so it doesn't tug and cause any pain or rip this out. There is a balloon at the end of this that is just above the patient's bladder, and that will hurt a lot if that is pulled out. So making sure this is clipped correctly. Okay, and also when I'm doing an assessment, I'm looking around the tip, making sure that there's no crusting, that there's no redness, no swelling, there's no signs of infection. Okay, when I'm doing pericure in this area, I want to make sure when I'm doing my bed bath that if this patient isn't circumcised, that I'm retracting the foreskin. I'm cleaning around the tip, and then around where I'm using a different cloth to clean around the tubing and the tip area there. Also, if he is not circumcised, I'm making sure that the foreskin is put back into place. Okay. with females, it's always going from outer to inner. So I cleanse the first from the outer, and then the last part would be the inner. Always using a different part of your rag